We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. I'm so excited to have here with us Dr. Bharat Sanders, who goes by Dr. B.
Yeah.
And we're so excited to have him on. I'll give him a full introduction, but welcome to the podcast.
Thank you, Brad. It's great to be here.
Your background is so incredible. He's a remarkable triple board resident physician in pediatrics, adult psychiatry, and child and adolescent psychiatry. Trained at the Medical School of College of Georgia. He's worked in rural health, community medicine, and trauma-informed care. His passion lies at the intersection of physical and mental health in children, especially understanding how early life adversity shapes long-term pain, coping, and resilience. Outside of medicine, he's a musician, an outdoors enthusiast who brings curiosity, calm, and compassion to the children he serves. Just such a remarkable thing that you're doing. I commend you for it. It is such a cool thing.
Thanks. And I realized that I used to be the most enthusiastic about the outdoors before I moved to Utah. And then now, I'm just an outdoor adjacent person, I feel like, compared to everyone who lives here.
Yeah.
But it's so nice to be here in this state and working kind of in my passions and what I've been planning to do for a long time.
Yeah, it's so cool. Today we are talking about ACEs.
Mm-hmm.
Tell us about ACEs, and then I'm gonna make some promises to our listeners. Just give us a brief introduction of what ACEs is.
Yeah, so you may have heard of the term ACEs in the context of health. ACEs stands for Adverse Childhood Experiences, and this we can delve into it a little bit later, but the initial studies that looked at these adverse childhood experiences that happen to people as they're young actually impact their physical and mental health across the lifespan. And it's really related to how sick you might be as an older person compared to how much you've experienced as a child or as a young person. So that really fascinated me in my medical career, knowing that if I could impact kids with these adverse experiences early on, potentially I could impact their physical and mental health.
What kind of
across
adverse
the lifespan.
Things are we talking about? We're talking about like a divorce in the family. Are we talking about trauma? Give us some examples.
Yeah. So the initial ACEs that were defined by this research group at Kaiser Permanente, there were abuse, neglect, and household dysfunction. And so abuse could be physical, emotional, sexual abuse. Neglect could be emotional or physical neglect. And then household dysfunction, like you mentioned, divorce in the family, witnessed domestic violence, an incarcerated parent. And then further studies have looked at other adverse experiences that weren't initially defined in that study, and those also have an impact. So these are like adverse community experiences, like experiencing discrimination, intergenerational trauma, going through a worldwide pandemic, like things like that actually do have an impact on your health as a community and as an individual.
Yeah, and today we're going to be talking, our promises to you is that you can understand how these adverse events are affecting your pain or how you're adapting to life, the physical aspect. Because we're going to be talking about the mental aspect and how these adverse events can really turn into later issues if they're not resolved. And I love this topic. We talked about it in PT school, and it has a lot of deep research to support it. And it's so important to go back and resolve these things and really see through the eyes of an adult now, because most of the time we have seen it through the eyes of a child and we interpreted it a certain way, and our unconscious mind just holds on to those things. So we're going to give you some tools in which that you can at least get started and help understand this area more. So tell us, what got you into this area?
Yeah, I mean, I had some really great mentorship in medical school. I always knew I wanted to work with kids, but the mentors that I worked with in medical school as I was discovering my specialty listened to my story and my interests in trauma. And they said, "You sound like a child psychiatrist. Like, have you thought about that?" And I kind of had to take a step back because I had a different concept of what being a doctor would be. And psychiatry wasn't that. But then when I delved deeper, I realized that psychiatrists are at their heart like applied neuroscientists. Like we think about the brain, where that was something I'd been interested in since I was a kid. And we're able to apply it to clinical medicine, help people get better with their functioning, right? Like help people gain back their functioning. And when it comes to kids, right? Like kids are supposed to be healthy. Kids are supposed to be functioning. And if a kid isn't doing well, or if they're depressed, or if they're anxious, or even God forbid they're suicidal, right? Like if I can step in there and help them regain a joy in their life, or reintegrate into their community, that gives me it makes me feel like that's a rewarding profession, right?
And this is such a big area. It's become so much bigger. I mean, even since the pandemic, right? How have you
Absolutely.
seen this area grow? And, we talked earlier about like, this is such a huge need. Give me your thoughts on that.
Yeah. So, I mean, I wasn't expecting it to increase so much, right? Like in the middle of med school is when the pandemic hit for me. And I definitely did see, as I worked in a lot of rural areas in med school, as you mentioned, I noticed that people didn't have access to mental health care. And this showed up in all specialties, right? It showed up in surgery, where the person who didn't have substance use care, drank too much, and then they needed gallbladder surgery, or things like that, where it was like every field showed up with illness because potentially trauma hadn't been addressed, or mental health hadn't been addressed. And that's showing up more and more in kids. And so there's not a one solution, but if we can all become more aware of it and work together, then we can potentially address this huge crisis that's growing.
Yeah, absolutely. I really want to dive into this first part of how early stress biologically changes the pain system. Tell us, as we dive into this topic, what exactly is the ACEs assessment, and how do you measure it clinically?
Yeah. So, like we talked about, the ACEs were those initial 10 adverse childhood experiences, and people have implemented screenings into their medical offices to understand, like, are these things that you have experienced, and if so, how can we help? And the way that we buffer those experiences is with resilience factors. And a lot of the research shows that one safe, stable, nurturing relationship in a child's life can be enough to buffer those negative experiences or reduce that impact of
Say
illness.
that again. That was
Yeah.
really good.
Yeah. So I like calling it SSNRs because it sounds kind of like a medication, but
Yeah.
one safe, stable, nurturing relationship in a child's life has been shown by research to help buffer and reduce some of the impacts of those ACEs, those adverse childhood
So it's not
experiences.
that they have to have 15 stable relationships. Just one makes a drastic difference.
Yeah, yeah, and the thought that I could potentially be that person for a kid as a child psychiatrist, or I could help encourage others to be that person, was really rewarding to me.
Yeah, that's so good. Tell me, obviously there's some documents or something to support, maybe questionnaires, the ACEs. Do you just ask questions to see if there's an adverse event in their childhood? How does that work?
Yeah, so a lot of people implement like a screening form, for example, as people enter their office and they're filling out the paperwork, and it'll ask about these various experiences. Have you had this experience or not? It's really important to have a way to address those things if you're going to screen for them.
Hmm.
And actually, a lot of our field has moved away from specifically screening for ACEs and more so looking at trauma symptoms. If you've had a traumatic experience in your past, if so, what was it? And then what types of things are you having as a result? Are you having sleep disturbance? Are you having issues with your mood regulation?
How
Are
does
you
someone tell if they've had that trauma in the past, if it's affecting them now?
It's not easy, right? Sometimes people don't know that it's affecting them, and that's a great question. I think if you've had something scary or upsetting in the past, it's really important to see a professional and maybe explore, is that affecting me now? Because two people could be in a car accident and one person ends up with PTSD and one doesn't. They're in the same car accident, right?
Yeah.
And so that's something that it would be really important to explore with a professional. I think going back to something you asked earlier, like how does the body respond to trauma? And there's so many different ways, but kind of dialing it down to a couple of different things. When you experience something scary, upsetting, your body wants to protect you from that happening again, right? And so a lot of times your body and your mind can react in a way where it becomes hypervigilant, or it becomes like more anxious about what might happen in the future so that you can prevent it, or you can get away from it if it were to happen again, right?
Yeah.
And that happens via a variety of like brain pathways and hormones and different things we don't have to go into, but that is protective, right? So that you can protect yourself, you can protect your family if something bad were to happen again. But unfortunately, if that trauma is very severe, or if you react to it in a certain way, or if it's repeated, like chronic stress, then it can often change your body and your mind in a way to where you become oversensitized to various things, and you're constantly in a state of stress, or it can show up more physically as in pain.
Yeah. I've seen a handful of cases clinically. One example is, someone that was in an auto accident as an adult. Every time they drive, they now have pain. It's the connection piece. Like, I had the trauma driving, and now I have pain every time I drive. And that, as a physical therapist, there are things that we can do and things that we can't, right? Because we're talking about the physical things that we can do in reducing stress with driving, but there is that biological component, the connection to the trauma in the past, that is reproducing that pain. Another one I'm thinking of is in the pelvic floor world, when someone had been sexually abused as a child, and then they get married and they're having intercourse, and it's very painful, and there's so much tied to the past that it can be painful for them for years. And it's not just a physical tightening or holding of muscles, it's more that they're protecting themselves from something that had happened in the past as well, which can be really challenging.
Yeah, I'd be curious to hear kind of your concept of physical therapy in this, but we know that neurons that fire together wire together, right? Like if we're working with the brain and the nervous system, we know that the more you reinforce a certain pattern of neurons, nerve cells firing, the more it's going to ingrain that pattern, right? And so I wonder, like physical therapists, I know everyone thinks of PTs as working with muscles, right? But you're almost working with the brain and the nervous system as well, right?
100%. Yeah. With the pelvic floor specifically, we focus a lot on the diaphragmatic breathing. I love, I can't remember what show my kids watch, where it teaches them to breathe, to essentially blow out the candles.
Might be Bluey.
Bluey. It is Bluey. Yes, definitely. We love Bluey.
Yeah.
But yeah, it teaches them how to breathe. But deep breaths, right? A lot of us use the short, shallow breaths in our chest, but the diaphragm is directly connected to the sympathetic nervous system. It's calming that nerve, the vagus nerve. So we teach people how to breathe and calm their body and their emotion, and recognize the emotion as well. What is it you're feeling? How can you use your breath to calm that sense down? And obviously not working through the mental component of that, but we're teaching people how to do the physical function and calm their body down at the same time. How does that relate to what you do?
Yeah, I mean, it sounds kind of corny, but breathing is such a great intervention, right, for trauma and for a lot of things. We work with breath a lot in psychiatry because it's free. It's right there with you all the time. And there's a lot of research to back it up, that slowing your breath and having a deep rhythmic breath, or a slow out breath, or a hold at the top of the breath, all of these things can activate the parasympathetic nervous system and help calm you down and retrain your brain. Relaxation exercises are just part of what we do. I think that, there's a whole lot of interventions that can help people feel more safe. And I really like the work of Dr. Bruce Perry. He's a neuroscientist and a child psychiatrist, PhD and an MD, really smart guy. Wrote the book "What Happened to You" with Oprah Winfrey. It's a great book to read if you're just getting your feet wet with this topic. But he created this model where understanding how the brain developed, and being able to kind of go back down that pathway when you're trying to heal trauma, to start with the brainstem, the rhythmic kind of basic functions that we have. And we start with like sensory activities, right? We want people to feel safe from a sensory standpoint. So are there things we can do with temperature or with weighted blankets or things that help people feel safe? And then once they're feeling sensorily safe, moving more to rhythm, right? Like music is something that people often use to feel better on their own. And that's actually an evidence-based way to help with trauma as well.
Yeah.
And then once they're dealing with more of that rhythm, getting their rhythms reorganized, then it's relational. Then you work with others and retrain your brain to understand that relationships can be safe. And that's often with family or close friends. And then your professionals that work with you, your therapist, your psychiatrist, to help you feel safe in community. And only then can you move to the cognitive part, like the front of your brain, the prefrontal cortex that does all your thinking and your organizing and your planning. And that's what you use when you're talking to someone, right? Like talk therapy, for example, you using that cognitive part. You can't get there. You can't do any really great work until you feel safe in the lower levels of your brain. And so I think that it's really important for us to use. I mean, this is one of the benefits of being a psychiatrist, right? I've learned all of the development and the neurological changes, and that helps inform my treatments of people when healing from trauma.
Yeah, I love that. And I love how you give some ideas of ways to promote the nervous system's safety. Music, breathing, these relaxation exercises. So much of what we do in physical therapy is mind-body awareness. And we do that in a sense of, can you feel this muscle tighten up? Can you relax that muscle? We teach people how to squeeze the muscle and then relax it. Most people with pain actually don't know how to relax the muscle. The muscle's always guarded because it's holding on to something of the past, whether it's an injury that, they were deadlifting and hurt their back. So even the thought of deadlifting hurts their back because they tighten up before they're actually lifting a weight, right? Even, if we're talking about intercourse, like muscles are tightening up before intercourse because of fear of pain, right? So much of what we do is teaching people these relaxation techniques. And I love the carryover. Earlier we talked about silo care, silo care being defined as I can do all of these things as a provider. Talk to me a little bit about, before we dive into other ways to promote down regulation of the nervous system. Tell me about ways that we work together in tandem as providers to help these people overcome these instances of the past.
Absolutely. The one thing that comes to mind right away is working with folks who are experiencing functional neurologic disorder. This is when people have neurologic symptoms, like maybe they are unable to walk or they lose sensation in their hands or feet, or different neurologic symptoms that we don't find a medical explanation for. We don't fully understand the body, right? Like it's still an untapped.
I used to have these cases. I think I had 5 cases of conversion disorders is one of the terms that we use for this.
Exactly.
This is where people like literally, it looks like they have a stroke, right? Meaning they can't use their arm or their leg. Like it literally doesn't function, but we can't put a physical diagnosis like a stroke on them because it's not a stroke.
And the research is really interesting because some people feel like they're being blamed, that it's all in their head, right? And yes, every aspect of perception of the world, everything you experience is coming from your brain, but there are actually different changes on what we call like functional imaging for if someone is actively choosing to do a symptom, say like they can't walk, if they feign that they can't walk, it looks really different on imaging on a brain MRI than it does when they have a functional symptom. So there's actually a connectivity change. There's some kind of wiring change that we don't fully understand yet. We just can't diagnose
So
it
meaning
medically.
on imaging, you can detect if someone's faking it or not. Like it's
Exactly.
very, very different. And these cases are showing that they're not faking it.
They're not.
It's actually physically happening, but there's no medical diagnosis physically that we're saying is going on.
And often the problem is if your body is giving you pain or if it's giving you a symptom, it's a flag to tell you like something's wrong, right? And if this happens in a kid, often the family is really concerned and really wants to make sure like, hey, is this life threatening? Like we need to go to the hospital. We need to do all of the tests to make sure that this is not something that's going to hurt my kid. But often that can be harmful and that can be reinforcing to do all of these medical tests and they're all negative. And so there's certain things we look for that we can determine that something is a functional neurologic disorder or conversion disorder, which was the old term. And if that is the case, then we work
So
directly
the
with
new terminology is what again?
functional neurologic disorder.
Okay,
Yeah.
so conversion disorder we've kind of shoved to the side. That's not really a term we use anymore.
It's got some stigma associated with it because it also has that aspect of like someone had a choice or someone was able to convert this mental symptom into a physical illness.
I see.
So I think some people still use that term and that's okay, but the newer term is the functional neurologic disorder.
Yeah.
But the really great thing is that we see people with FND get better, right?
Yeah.
And we see them get better when we involve PT and OT and help rebuild that functioning because essentially they've lost function. We don't know exactly what piece of their brain or what connectivity wiring is not working right, but we know how to build it back, and that's by working with therapists to rewire the brain.
Yeah, absolutely. So what strategies help regulate a child's stress? Like what are things that they can do as a child? If my daughter's just really anxious about something, what are some strategies that she can use to calm that down?
Yeah, kids need to learn to co-regulate before they can self-regulate. And so for a parent, it's really important to learn about your own mental health. Like what are the things that are stressing you out that often then carry down to your kids? So if you as a parent can address a situation regulated, like your kid screaming, crying in the grocery store, if you come to that by telling them, shh, like, no, stop, don't do that. That's not going to help them regulate. You have to be regulated first before you can co-regulate.
I love
with
how
your kid.
I asked you a question about how the kid can do it, and you rephrase it by saying, well, you start with the parent. Because if the parent is not modeling that, the child is going to do the very similar thing because they do what they see.
And part of it is modeling and part of it is energetic. Like I don't even know exactly how to describe it scientifically, but the kid knows that you're not feeling okay, and then they're not feeling okay because you're their whole world, right?
Yeah.
And so there are strategies, right? There's also tools a parent can use, can teach their kid how to do deep breathing. They can maybe use an ice pack to distract a sensation away from what the child is feeling pain somewhere else. There's different strategies we use that are more tangible, but I think that regulation piece is so important because anytime we're working with kids, we're working with the whole family.
Yeah. I love this. My daughter is here with us. My wife, Lexi, was in a car accident a couple weeks ago.
Oh, no.
And she got a head injury, a neck injury, and an arm injury. And my cute little daughter, Emerson, all of a sudden her head started hurting and her arm started hurting. And my cute little boy took my keys and hid them because he didn't tell me this. It took me 6 hours to find my keys. He hid the keys under like this play area underneath the stairs because he didn't want me to drive and get hurt. It's just really interesting what our kids do to model what they see. And then they're trying to protect as well.
Yeah. They have such a unique way of looking at the world. Every age is different. And so every kid has a developmentally different way of understanding. And maybe your younger son felt like driving is no longer safe. And so now that's a way to protect his family, is by hiding the keys, versus your daughter's maybe more empathetic and feels the pain of others around her. And so that
It's so
it's
true.
amazing.
It is so true. And you don't even realize, I mean, my son that was in the car accident didn't faze him at all.
Mm-hmm.
He just, it seems, right? He just kind of bounces around. He's like, yeah, it was fine.
Yeah.
And then my daughter, who was not a part of it, I thought it would affect her a lot. But, she's very empathetic and she's caring for mom. But my little boy, 6-year-old, he was terrified. And the one that I didn't think it would affect at all, we just had called them on the phone. Well, my mother-in-law and father-in-law picked him up and said, hey, your mom and brothers were in a car accident. And all he saw is, huge harm to them. It's okay, just so nervous. Hey, but you don't even realize how much it affects each one of your children.
Yeah. And everyone's going to respond completely differently. And trauma is inherently complicated, right? Like there's different things going on in your environment when you hear about that car accident, or when you're in the car accident, and you never know, years later, maybe grandma was baking bread when you heard about someone who got in a car accident, and then you have that same smell years later, and then you have a stress response. So that trauma is so multifaceted. Like you don't always know like what exactly is going to stick in your brain as something that's going to trigger something later.
Yeah. And that wiring system through sensation is really interesting as well. I love that you commented on like the smell of bread when you hear about a trauma and how that association can happen, right? I remember as a child, I had thrown up and I was eating tomatoes. I've had an adverse, connection with raw tomatoes ever since.
Oh,
and
no.
I cannot eat raw tomatoes. And I try them every once in a while. I still can't do it. But you connect those things to each other, and it really makes a big difference. So how do, say an adult has these adverse events as a child, what can parents do to help break these cycles of fear-based pain responses?
Yeah.
What advice would you give the parents more?
It's really important to recognize that trauma is not a prescription, right? Like it's not saying like, because you've had these adverse childhood experiences, you will have more illness. You will have 3 times higher cancer, 4 times higher pulmonary disease. Like these are real outcomes that we've seen, but we do know that they're buffered, right? Like those effects can decrease with resilience factors, with having those safe and stable nurturing relationships, with having positive community experiences, people rallying around you, and having appropriate medical care and mental health care. And so if a parent has a child who's experiencing pain or other symptoms as a result of a traumatic experience, it's really just important to move forward, right? And to get the care they need, to see a professional, and determine like, are there different treatments that can help them?
How does a parent know if they should seek professional mental health advice for their child?
I think if your kid has any decrease in their functioning, is what we look at as a psychiatrist. If there's a sudden like drop in their grades at school, or they're no longer interacting with peers as much as before, they're isolating away from people, or they're not eating as much, or not sleeping as much, or sleeping more, or eating more, like big changes in your child's behavior, especially if it's affecting their functioning. And we look at functioning meaning relationships, right? And school performance. Like those are the big measurements in kids. If those things are changing dramatically, you might need some extra help. And you can always start with your pediatrician, and they can help you decide whether whether you need like a higher level of care or a specialist to see your kid.
Yeah, I love that. So going back to ACEs for a minute, we talked about ACEs being kind of defined as these adverse events early in life, that they can be a predictor of cancer, they can be a predictor of heart conditions, like all kinds of issues, right? But it also means that it doesn't have to be, right? Mm-hmm. That you talked about these buffers, or implanting resilient pieces, or relationships, or community bonds. So just because someone's had these adverse events, these traumas early in life, it doesn't mean that they're going to have all these piles of health concerns later in life, correct?
Exactly. And what we do know as well is that these adverse childhood experiences are often correlated with increased like risk behaviors, right? Like increased substance use and decreased reaching out to community. So those types of things are what are also, related to worsened health. We know that it's really important to eat well, to sleep well, to have good community, to avoid substances. Like these things help with your health. And unfortunately, when you have increased stress early in life, often you turn to those things as coping skills, those negative things. And so if we can intervene before that, or even amongst that, if we can reduce how much people like have risky behaviors, then it can decrease how much cancer they experience or decrease their risk of heart disease and those types of things.
Yeah. Yeah. What is the balance between, I think about putting my kids in challenging situations to essentially stretch them. What is the balance between, giving them appropriate challenge and stressing them too much?
Mm-hmm. Yeah, that's a really great question, because I think some parents react to hearing about ACEs by completely trying to prevent any conflict in their
It's
kids'
like, I'm
lives.
never going to have any hard thing for my child, and I'm going to put them in this bubble, right?
Yeah. And we actually have some really great research to show that kids who experience some adversity but are buffered by those resilience factors are much more successful in life than kids who have not experienced any adversity at all. So I think that's really encouraging, because it means that people who have experienced ACEs, which is a lot of people, right? Like this, we're talking like
The majority.
60% or 80% of people who have had at least one ACE, and about 20 to 30% who have had 4 or more ACEs. These folks are often more resilient. They're often able to cope with the things that life throws at them. If you think about a flower that grows inside of like a glass dome, and then you put it outside in the winter, like it's going to die immediately, right? But if you think about a tree that's been outside and it's been weathered and the wind has blown it, but it's grown up strong, like that tree is going to survive through all the seasons. And so having kids is like that, right? Like you want your kids to experience some level of challenge in life. Shielding them from conflict is not going to help them in the long run, because they won't be able to weather the storms that life will throw at them.
Yeah, absolutely. I love that. And it's such a good analogy with the body and how the body functions physically. We think about our muscles. If you overload your muscles, they break down too much.
Mm-hmm.
Our goal there's something called delayed onset muscle soreness. That's little micro tears that happen in your muscle from working out too hard too soon. And that's good. Muscle soreness is great, but you're literally breaking down the tissue to then build it back up. If that DOMS, that delayed onset muscle soreness, lasts longer than 48 hours, you push the tissue too hard. If you push it even way too hard, that's when you can have strains and sprains and tears. But it's really interesting what you say is like the tree comparison. This tree has weathered storms over time, right? If you apply too much stress to the tree, it can break. If you apply just enough, it gets stronger. And that's how the body works as well. And that's how these their children could be resilient as you add appropriate life stressors to them over time.
And relationships are the same way too, right? Like you're going to get into fights with your significant other, with your kids, and often that feels really bad to us. But in psychiatry, we call it rupture and repair, right? Like there's this back and forth with all of the relationships in your life, and there are going to be ruptures, and that's actually a good thing if you can repair it, if you can build back that relationship stronger, kind of similar to the delayed onset, what did you call it?
Delayed onset muscle soreness.
Muscle soreness. If we add a little bit of that to relationships, then they end up being stronger in the long run as well.
So tell me about, when kids see their parents fight, is this a good thing, not so good thing? Because you said it's appropriate for them to see those challenges, but also that you repair it, right?
Yeah, I was just talking to a teenager the other day who said, my parents were perfect growing up. I never saw any conflict, and I'm so upset at them for that, because now I'm navigating relationships and I don't know how to do it. I don't know how to deal with conflict, and he's figuring it out on his own, and I'm glad that he has the help he needs. But when you don't see conflict and you don't see it repaired, then you don't know how to navigate those things in your life as a teenager, as an adult.
Yeah, that is one thing that we're focusing on a lot with our kids is you have conflict, but in this family we resolve it. In society, that's what we need to do. Like we talk about hard things, we sit down face to face, and we talk about it and resolve it together, because that's the only way we can move forward. But yes, this resistance that we have in life with relationships, with our bodies, with the trauma of the past, it's so important. But how you actually resolve it is more important. Tell me about, this resolve, the mental resolve. We're talking about the things of the past that's been brought up, maybe a trauma, maybe just an adverse event, maybe neglect, these things. How do people really resolve those things of the past?
Yeah, there are some ways that we are able to revisit traumatic experiences with a reintegration of those experiences into your life, understanding how those things have impacted you, how the person who maybe caused the trauma came along with their own baggage or their own trauma. Essentially reintegrating the experience in a safe setting helps retrain your mind to move forward. There's a lot that we have to do in advance of that, right? We have to help someone feel safe. We have to help them learn how to deal with distress that can come up during those things. So a lot of our trauma-based or trauma-focused therapies do eventually delve into the specific trauma story, but they utilize a lot of things around that to help someone feel safe and retrain their brain
Yeah.
around what happened.
Someone did this with me where they actually had me bring up the trauma from the past and sit in the situation with it and talk about it, but then essentially get me to think, if you were outside of your body looking down at your body now, what would your older version of yourself say to your younger version that interpret it that way? Because I had this incident where, I had something happen as a child where I believed that my dad was really angry with me and I felt like I didn't belong.
Mm-hmm.
And how I did that in the now is I wanted to feel that people respected me and that I had a space and I felt like I belonged. So I did certain things in the now because of something in the past. But then he had me step out of my body essentially and just look down at myself and say, what advice would you give yourself now? And looking back, I thought of my dad, and he was in hard circumstances and that he was responding the best way that he knew how. And my 8-year-old self thought that I didn't belong. And then I thought, did he really want that for me at that time? And the truth was absolutely not. Right. And by going back to that situation in the now, as my older version of myself now as a dad, I could really resolve that so much more. So yes, we all want to feel like we belong, but I don't have that need nearly as much. I don't have to necessarily prove myself to be that I need to belong, because I know I belong.
Yeah, thank you for sharing that. That's so powerful, and it also brings up a really important point that parents often have things come up as they're being a parent, like as your child is in the age and stage where you were when hard things happened to you as a kid. That often brings that up for you as a parent, and being able to reparent not only your kids and break that cycle, but to reparent yourself and to give yourself compassion and give your parents compassion, the people around you, is such a powerful thing, and that is really healing.
Yeah, absolutely. Any other strategies or tips that you'd give our listeners today that maybe have been through this, or maybe their children are going through it? Anything else you'd add?
I think it's the current world we live in is really disconnected, and that doesn't lend itself well to healing trauma. If we look back at our ancestral societies, often difficult things were healed in community, and in this individualistic American society we live in, people are often fiercely independent, and I can do it myself and I can get better on my own. And even therapy is right, like I'm going to go talk to this one therapist and get through it, and that's helpful, but it's not everything. And until and unless we find that community that can rally around us, I think is we're not going to get better, right? We have to understand that we are human beings in community. We have to have the society around us to help us to understand ourselves and to heal and to have that conflict and repair, and all of those things retrain our brain that relationships are okay and relationships are safe, and being in amongst people is safe. So I think that it's really important that we, get off of our devices and connect really in person and have conversations and build bridges with each other, and return to a way that maybe our ancestors knew better to heal that trauma.
Yeah, I love that. I read a research article once. I don't know how true this is, but I read a research article that said that feeling disconnected is just as bad on your health as smoking 4 packs of cigarettes a day, long term, right? So we feel disconnected from our relationships or our community. It literally has a physical, biological, physiological stressor on our body that is very, very negative. What advice would you give people that maybe feel disconnected from their community or from their relationships? What you talked about, putting your devices down. What other tips would you give people to truly connect?
The research shows actually that connection, both deep and like shallow connections, are both helpful to your health. So I would say start with those just like everyday connections. You're walking through the grocery store and you talk to the cashier about their day, right? And ask them about something they're doing this weekend. And that's practice, right? Like that helps train your brain to have more interaction. Sometimes it can feel scary at first, and that's okay. You can be walking down the street or driving to wherever your kid's school or something, and you have a conversation with the person in the car ride or line, or just connect with people, right? Like have those smaller conversations. And it's interesting. There's these places on Earth called blue zones, and they're places where people live. There's a high percentage of people who live above the age of 100, and food is important, diet is exercise is important in those societies. But some of the things that correlate the most with people living above the age of 100 and being healthy is A, having deep social connections with the people closest to you, and B, having those just small interactions day to day, having people that you interact with that you're not just isolating away in your house.
Yeah, and I think that's a book, if I remember right, Blue Zones. Yeah, if you haven't read that book, it's a really good book, and it teaches about pretty much longevity. If you really want to create longevity, there's certain places in the world where people are just thriving longevity-wise, and there's certain key aspects that they're doing. And you alluded to a few of them: exercise, social connection, the way we eat, that way we do things during the day, nap time, all those critical pieces that I think a lot of us know, but there's so many life stressors, especially in the American culture, that limit our ability to do these certain things consistently.
Yeah. And another thing I would add is if you're already struggling, right? Like you're already experiencing anxiety or depression, and definitely reach out for help. You're not alone in it. You can ask for help from friends, from family. There's the 988 helpline, right? That's 24/7. You can call. It's like 911, but for mental health. And you can get someone to come out to your house and check on
So
your
people literally dial 988.
Yeah, or if you don't want to talk on the phone, you can text it too. It's really great, and it's a national helpline here. It's actually
I was
routed
personally
to,
unaware of that, so that is good to know.
Yeah. 988 is a great resource, and is able to triage and help you figure out like what is it that you need in this moment, and do you need some extra help? And if you're not quite at that crisis level, but you do need help, think about like how you can. Well, I guess what I want to say is that often we mistake trauma for other things, right? Like it might show up as anxiety because you're hypervigilant, or it might show up as depression because it affects your moods and your emotions. But if you can explore that with a professional and dig deep to like the root cause of why you're feeling the way you are, maybe it's pain as well. Sometimes it uncovers things that you didn't realize were underlying everything. And that's not something that necessarily medicine is going to fix, like a prescription pill. It might be something that you have to really work on and retrain your brain to feel better from.
That's so awesome. Okay, I got 2 last questions and then we'll wrap up here. My first one is, parents that feel very overwhelmed with having their kids in 7 sports and 7 different activities, and they're just running around stressed. What are these overbookings for our children doing? And what advice would you give on that area? Because parents feel very overwhelmed. They feel like their kids are not going to keep up if they're not keeping up with the Joneses. And that they're not in all these different aspects. But I believe that this is having a very detrimental effect on these children because they're overscheduled. Tell us your thoughts on that.
Well, first of all, I'm not a parent, so I don't want to overspeak for myself, but I do see that a lot, and it's really important to think about, like, why are we doing this? Like, what is the purpose of all of the things we're doing? If it's does it spark joy, right? Like, is this something that is bringing my family closer together or helping my kid to pursue an interest that they're really excited about? Or is it just because the Joneses next door are in 5 activities, so we have to be in 7 to be more achieving or to be doing life right? Like, there's no way to do life right. I think prioritizing connection, prioritizing like what your children are excited about, and noticing like maybe their aptitude for one thing or 2 things maximum, like, could be really helpful in helping them not feel that chronic stress, right? Like, even that, it's not necessarily a trauma, but that chronic level of like, we're rushing here, we're going to X practice Y thing, going to school. There's a lot of things on the kid's mind all the time. They're going to feel that stress, and that's going to become a pattern that follows them. We know that kids in Scandinavian countries like Sweden, Denmark, Finland are some of the happiest kids on earth, and they do like 2 to 4 hours of school, and then they spend most of their day playing. And kids learn through play. They develop skills through play, and they're not necessarily running from activity to activity, but they're happy and they're really successful as well.
Yeah. My kids love to wrestle.
Mm-hmm.
I actually owe them a wrestle this afternoon because I promised them yesterday and the day before we would wrestle, but life happened and we didn't make it happen. So, but they love to wrestle. And what I've learned through wrestling or rough playing with my children is it develops resilience in them because it's a safe environment, but they have to kind of fight. Right. And I kind of really make them fight. Like my little boy right now, I'm teaching him, I'm throwing him around, and it establishes a safe space, but develops this resiliency in their mind. It's helping with this rewiring or this wiring, appropriate wiring. Right.
Yeah, it's connection. It's teaching them the boundaries of their body and what they can and can't do. And I think that's so great and so important to do with all of your kids, boys and girls.
Yeah, absolutely. And my daughter too. I throw her around. I don't mess around. I throw those pillows really hard.
Nice.
But it's so much fun. Okay, my last question. I know a lot of people are concerned about access to mental health. That's a huge barrier that we face, especially in Utah. I don't know how it is nationally. Tell us about your thoughts about access and how someone can get into a great psychiatrist. What are the steps that they do?
Yeah, we struggle with this all the time. I mean, there's a shortage of child psychiatrists across the country, and especially when it comes to rural areas, as I mentioned. I mean, I saw people languish in hospitals, and kids spent 30 days in emergency rooms waiting for a psychiatrist to see them, and then people just struggle to get in with someone, and so they have a lot of issues and with access. So that's a really good point. One thing we've been doing as a movement in psychiatry is what we call mental health integration, and that means that we're finding ways to partner with primary care providers like pediatricians, family medicine doctors, maybe with PTs we can do that as well. It would be an easier way for someone to access mental health if they're already going to their pediatrician and, you're struggling with something, like, let's pull in the psychologist, or let's pull in you can schedule a visit with the psychiatrist who's just down the hall. And that's become a more common model across the country.
Is it hard to get into a psychiatrist? Say you form that partnership where there's that referral aspect. Is it still difficult for a patient to get into you?
A lot of places it is pretty hard, and we have like months-long wait lists, and that's why we have to partner with primary care providers to help provide that like first-line medical or mental health care.
So essentially, they're gonna be trained on these pieces of psychiatry.
Yes, so
where they can start the process.
Yeah, so pediatricians are now being trained in residency to do basic mental health care, and that's a new development as of the last year or so.
What pieces do you oversee them, or what pieces do you see them taking over?
Usually it's those first line interventions, so screening for various conditions, anxiety, depression, trauma, and then also some like light medication management, so initial medications that could be helpful with a child or family's condition, and then getting them in to see a therapist, having those appropriate referrals and relationships in the community.
So if say a physical therapist, or because physical therapists are now primary care providers in Utah,
I know.
and what does the wait list look like? If I was to get a patient, a pediatric patient, onto your schedule or anyone else's, what would that look like?
It's usually a few months. So that's really challenging. And I know families often only feel comfortable reaching out for that level of care when things get pretty bad.
Yeah.
And so it's really hard to sit with that for a few months and not have any help. And that's why we still have this problem of kids in hospitals who are needing this care, right? Like going to emergency rooms. And unfortunately here in Utah, I would say we have a pretty high level of resources for mental health care. So if you show up with your kid we have a now 24-hour receiving center at the University of Utah where youth can come in. There's a lot of locations around the valley. But if your kid
Is
comes
that in the
in,
emergency room at the University of Utah?
so there's actually a specific mental health receiving center now at the University of Utah.
You just find that on Google.
Mm-hmm.
Okay.
Yep. It's up at the University of Utah up on the hill. And then there's also the Primary Children's Taylorsville Behavioral Health Campus just opened as well. So they have a place where you can go in for crisis. And so
How about the one in Lehigh? Is that one?
I think Lehigh also has services, but the Taylorsville campus is specific to mental health.
Okay.
And so, if you show up at any of these places, even if you show up at your local emergency department, you will get services that you need for your kid to keep them safe. And I would say we have a pretty high level of resources to help keep kids safe and get them out of crisis. But when it comes to long-term management, making sure a kid has the right therapist or psychiatrist, sometimes that can take quite a while. And so it's frustrating for people.
It does sound like, people have the resources if there's immediate need, emergent needs.
Mm-hmm.
But if there's something underlying that we need to work on, then get on the schedule and we can start working through it.
Exactly.
And then once you're in, it's probably less difficult to it's not like you're seeing them every 3-4 months. Maybe it's more frequent than that.
It's definitely easier once you're already in. But one thing that I love about psychiatry, and the part of the reason why it's hard to get in, is we spend a lot of time with patients, right? We have to understand everything in their life. We have to understand the biological factors, the psychological factors, and the social factors before we can decide what's the right path forward for you. And so I spend 90 minutes with a new patient, and you don't get to do that in a lot of other specialties.
100%.
It's really rewarding, and it's also really hard because we can only see so many patients a day.
Yeah, that takes up a big portion of your day, a 90-minute session.
Yeah, plus all the thinking about them beforehand and afterwards that, I want to make sure we do the right thing for each patient. So it takes a long time.
How do providers, primary care roles get to know the right referral sources? How would any of them know where to refer to?
Yeah, I mean, a good Google search is always helpful. I think connecting with any providers in your local community is helpful. You start to develop those relationships over time.
Just Googling psychiatrists, within this certain region and just finding them and connecting with them.
Yeah, and often, unfortunately, in our country, I mean, everything is driven by insurance. And so often it's talking to the patient and helping them look at their insurance, like who is covered by your insurance, and then having them call multiple providers in the area. But, there's such power in relationships too. I mean, if one of my pediatrician friends were to call me and say, hey, my patient really needs this, like maybe there's something we can do to like squeeze them in a little sooner. So I think it is important for primary care providers to get to know the services in their area.
Yeah, one of the biggest things that we find challenging in private practice is, say you Google it and you find Dr. Sanders on Google. We'll call offices and we can actually never get to you. Unless we have a specific patient that's like, hey, I have this patient, I need to get to Dr. Sanders. Can I talk with him about the patient? That is literally the only way we can get a hold of you. Is there any other strategies that you would give to help us network together more? Obviously, I met you at a party.
I was going
right?
to say you're doing it right now. Like, it's really important to build connections, right? We're part of this system, and sometimes you feel like a cog in the wheel, and you're just like carrying forth your job. But it's really about people, right? Like we're working with people, and if you get to know people in your personal life and you connect in a conversation like this, like that's how it works with legislative advocacy too, right? If you get to know your state senators and representatives, you can often tell them your opinions about things and have some more sway in that. And so I think connecting individually is really important. And I don't know if there's any specific ways to do that other than joining like professional organizations in the area. Often like the Utah Medical Association will help like connect people in that way.
Yeah.
Or the Utah Psychiatric Association. I feel like we could do a better job of not being as siloed and connecting with PCPs as well.
Ultimately, I mean, I say this, I love networking. I love going to parties where I can get to know people. Like I insert myself into those places and put a lot of an intention behind getting to know people and making sure I save their contacts and stay in connection with them and create relationships like this where we can have conversations. But a lot of providers don't know how to do that. And these resources that you've given are really helpful. But yeah, anytime you go to a conference, anytime you go to a party where there's multidisciplines there, like get to know people, because you want to get to know me just as much as I want to get to know you. Great providers want a great network that they can refer to and that we can work together as a team. And if you're consistently looking for that, it will find you.
Absolutely.
Yeah. Like I am a 100% believer. I've developed a really strong network because I consistently look for it. I look for opportunities to connect. And if you're a young provider or a provider that's been in practice for a long time, you don't know how to do that, I would say just start looking for it and Google it, find ways, have lunches with people, set up things, because healthcare is just getting more complicated. And unless we're working together as a collective team, the human race will not get the best healthcare possible. And we all went into our professions because we believe that healthcare can truly transform lives. You know, there's so much value we can add to the world. But until we all work together as a team, it really can't get the best benefits for the patient.
Absolutely. So, I'm glad you're doing that and helping build those connections and bridges.
Well, thank you for joining us on this podcast today. Such an important topic. It's such great insight that you've given us today. Thank you for what you're doing for the community, all you're doing to serve, the heart, the effort, everything that you've done to dedicate your life to the betterment of our society. Thank you.
Thank you. You too. And I'm happy to share some resources afterwards too, if you want to add it to
let's
podcast
add it right
page.
Now.
So one thing that can be super helpful for folks is the National Child Traumatic Stress Network. If you want to learn more about adverse childhood experiences, about trauma, nctsn.org, I believe.
Education, that would be a good place to go to start studying more.
Yeah, education, resources, curriculum, trainings, and they're all free, right? Like it's all funded by a federal grant, and I even like help run curricula through them, understanding more about childhood trauma. So I think that that's a really great resource for people across, rural areas, urban areas, everywhere, and in lots of different languages too. So that's a great resource. And then I mentioned that book, What Happened to You, by Bruce Perry and Oprah Winfrey. I feel like that's a great, like, approachable book for anyone to understand
Oprah
about
Winfrey's
trauma.
Background. I actually lived in the city temporarily that she grew up in.
Oh, wow.
And that city is wild. You would never guess in a million years that's where Oprah Winfrey grew up.
Yeah.
Like, I remember walking through there thinking I was in a third world country.
Yeah. Yeah. It's wild to see stories of resilience like that, right? Like she is such a great example of resilience and turning that pain into power.
Yeah.
And she's been trying to help spread that to everyone else. So I think that's really amazing that she does that.
For sure. Any other resources?
Yeah, Dr. Nadine Burke-Harris. She was the first Surgeon General of California, but is a pediatrician, and she initially kind of like spread this ACEs topic to the world through her TED Talks. I would definitely check out her TED Talk about ACEs on YouTube. And I read her book, The Deepest Well, years ago, and that was one of my inspiration points for getting into this field. So
awesome.
Yeah, definitely check that out.
Such great resources. Well, thank you again for joining us on the podcast today.
Thanks so much, Brad. It was great being with you.